Welcome, welcome. So my name is Jamila, and I'm your host for today. And this is the Summit for Somatics and Psychedelics and Trauma Healing. And the session that we're about to dive into is called Somatic Psychedelic Facilitation, Cultivating Embodied Wholeness and Connection with Dr. Devon Christie. And so as our community gathers from various corners of the globe, we love to acknowledge that the land that we live and work on is the traditional territory of many Indigenous peoples. And so we respectfully honor these people, their cultures, traditions. Let me introduce you to our amazing guest today, Dr. Devon Christie, a clinical instructor at UBC Department of Medicine and is dedicated family doctor with a focus in chronic pain and mental health. And her clinical work at the Canadian Pain and Regenerative Institute, the online psychotherapy practice in Vancouver, she brings holistic approach to her patients and clients. As a former clinical investigator and student therapist in MDMA-assisted therapy research for PTSD with MAPS, Devon is at the forefront of psychedelic therapy advancements. Her extensive certifications in functional medicine, mindfulness-based stress reduction, relational somatic therapy level 1, internal family systems, MAPS, MDMA-assisted therapy, and ketamine-assisted therapy underscore her commitment to comprehensive healing. Formerly the NUMIS senior leader of psychedelic programs, Devon played a key role in developing and implementing psychedelic-assisted clinical and therapist training programs. Currently, she imparts her wisdom to therapists in renowned training programs such as CIIS, IPI, ATMA, and VITAL, and Embody Lab, prioritizing ethical practice, mindfulness, and trauma-specific skills. Devon's practice lies in reshaping the healthcare paradigm by integrating trauma-informed biopsychosocial approaches. She envisions the careful introduction of psychedelic-assisted therapies as a transformative step towards a holistic healthcare model, echoing the principles traditional systems of healing have long embraced. In her recently self-published ebook, Integrative Somatic Psychedelic-Assisted Therapy, she outlines important elements of this paradigm shift. So grateful to have you here with us today. Thank you.
Thank you so much, Jamila and Liv, for your support. And thank you everyone for being here, and to Embody Lab for hosting us all today. I really appreciate this international community and what it stands for. And it's actually brings so much heart that there are so many people tuning in from all over the world today, interested in this topic. And I'll share before we go into my presentation that I'm joining you today from the traditional and ancestral lands of the Musqueam, the Squamish and Tsleil-Waututh people here in the Pacific Northwest of North America, also known as Vancouver, BC, where I live and work and play, and deeply appreciate how these lands have been stewarded over time. And I'm very committed to healing the ruptures of history that have happened with colonization here. So my talk today, I'll share my screen. Just give me a second. There we go. I think you should be able to see the full screen. Yeah, thumbs up, Jamila, we're good? Awesome. My talk today is on somatic psychedelic facilitation, cultivating embodied wholeness and connection. And many of you were present for Dr. Manesh Gurn's talk just before mine. And we were actually working together. So we're currently co-authoring a paper, which I'm really excited about, so that what we're talking about today, both of us can have its place in the academic literature to really forward the conversation about how we're thinking about and applying therapeutic modalities specifically related to psychedelic healing and the neuroscience behind it. And yeah, my presentation will build upon a lot of the foundations that Manesh has outlined. I thought he did a fantastic job of translating really complex stuff into plain language, and I saw how so many of you were really happy to receive that, and that's so wonderful. I'll be explaining things as well, so there will be some overlap and maybe some images and even some different language applied to some of the same concepts he talked to. I really believe in understanding things from so many different lenses and perspectives. Before you all joined, Jamila and I were talking about, energy work and ancient ways of knowing, and the interface of that with quantum physics, and as well these computational neuroscience work that is happening now that Manish is involved in. And in many ways, I see these as different ways of understanding and describing experience, different languages, if you will. And I deeply appreciate that we can talk about things and orient to things from many different perspectives. And also that, many of the indigenous people who have carried psychedelic medicine since time immemorial as part of their culture, their ways, their knowledge systems, their healing, their community, there may be different epistemologies or ways of knowing that are not the same language as computational neuroscience. And that doesn't mean that one is superior or inferior whatsoever. I think the more ways we can speak to and understand one another and our experience that we share, the better. So let's get going here. So just to orient you to my talk today, I'll be reviewing some of the assumptions of integrative somatic healing that I believe are really important in understanding it holistically. And always good to describe the assumptions that we're working with so that we can really know and orient to the perspectives shared. And then I'll be talking about cultivating safety in relationship-centered care. So these assumptions and cultivating safety, I believe they actually apply. And as you listen, as I carry on with the presentation, they apply or ought to apply to all of our modern healing systems. And specifically, there's an opportunity, since psychedelic-assisted therapies are coming into modern healthcare now from research very newly. We have an opportunity to take a lot of what in much of the research actually, or some of it at least, is actually a new paradigm that challenges paradigms of our dominant healthcare system right now. And I think that's a wonderful opportunity that we have and platform that we have. And then after this, I'll be speaking about what I call the 5 invitations of embodied inquiry. Embodied inquiry being a method or a description for a method of working somatically in psychedelic facilitation, and 5 invitations being the kind of framework that we can both explain to the people we work with so that there's consent and understanding about the assumptions and the worldview and the model that we're going to be collaborating within from this approach. And also to keep in mind as we're practicing, as we're facilitating and guiding. And then I'll finish with talking about how this method, this 5 invitations and embodied inquiry, can apply across the full arc of somatic psychedelic facilitation, from the preparatory phase into medicine sessions themselves, and also really importantly, through the integration phase of the work. Now, humans are dynamic, complex systems, or we can think of ourselves this way. Dynamic meaning changing and updating and responding moment by moment to new information, but also complex, meaning there are all kinds of different feedback loops and networks of systems working within us, different systems of our body, immune, digestion, cardiovascular, and also we are complex systems that are open systems. So we're open to our socio-environmental context and constantly responding and taking in that information. And so this is in some ways already a lot of what Dr. Gurn was talking about, Dr. Manesh, that we have this predictive coding kind of way of understanding how we are present to and relating to our reality moment to moment. And it's both bottom up and top down. And the definition of a complex system is that there's interactions happening between the internal components as well as external influences. And these interactions are nonlinear, and they often involve multiple energy states and feedback loops. And then we can add this understanding as well that we are not just biological or physical beings. We have a mental world of all of our thoughts and abstractions and interpretations. And we have an emotional world that we exist within as well, the felt sense of our emotions that, as Dr. Manesh explained as well, are coming in through interoception and through felt states in the body. And we can also consider the spiritual dimension of our being, one that science, as of yet late, has still not fully had the ability to explain with its language, but that has been spoken to and experienced by human beings around the world since time immemorial. So we are multidimensional dynamic complex systems, and we are relational. And it's that existence in relationship to our ever-changing and historic socio-environmental context. We exist in relationship. And that's going to be really important in terms of what we're talking about today. And we have these mechanisms that science has explained with these words, epigenetics and neuroplasticity. And they're really exciting, I think, mechanisms that we're understanding, because epigenetics means how our genes get translated moment by moment can change according to changing factors. And neuroplasticity means our brain might get wired a certain way. It might get wired developmentally through what we have or what we're missing in our environments. And our brains can change. Our brains have the ability to take in new information and to update. And this is all very helpful and very promising, and I think really underlies the deepest healing that is possible. And complex dynamic systems also have this property called self-organization. And so self-organization is this tendency of systems to favor distinct recurring patterns or states. And when we think about, what Dr. Manesh was talking about as maladaptive patterns that might develop if we're missing certain important developmental inputs, for example, in conditions of relational or emotional neglect, then the system is going to self-organize in response to those inputs. And it's going to self-organize in a way that is going to be as adaptive as possible. So what we might call maladaptive strategies ultimately at the time are as adaptive as they can be. We are highly intelligent beings across all the systems of our being. And it's one of the reasons I really love the internal family systems model of therapy and all of the somatic modalities that I've been exposed to and also trained in, is that there's this notion of healing intelligence, that while we might develop parts that are managers or protectors in response to adversity at some point, those managers and protectors are doing the best they can. And in healing, we're actually wanting to learn about them and their methods and understand better and explore it across all the dimensions of our being so that they can update, they can learn more adaptive ways to help us and maybe release their grip or control and allow us to have much more choice and agency in what we refer to as self-leadership and internal family systems. And as we heal, there's this concept of healing intelligence that's part of this intelligence of life that's underlying the principle of self-organization, that's going to take nourishing inputs and new information and given optimal circumstances, help us to update towards healing, towards the most coherent, and as Atira shared in her presentation, towards our blueprint that is never lost to us. So that is a little bit about just kind of how we assume or think about humans as these open, relational, dynamic, complex systems from this approach. Now, this approach is different from the dominant paradigm in medical care right now, which is more founded upon part of really reductionistic science. And I'm not going to badmouth reductionism. In fact, reductionism has really helped us to deeply understand things all the way down to the molecular level by separating things apart and looking at them very separately, like under a microscope. And but there can be a limitation if we only stay in a reductionist way of thinking, by thinking of things as separate parts, like separate organ systems. Like we've got cardiologists and we've got gastroenterologists, and like they're not talking to each other. But really, in our body, when we think about complex systems, they absolutely are. So, so there's a sophistication of a reductionist paradigm, but there's also a sophistication of a complex systems paradigm. And I think the future lies in really being able to, as I said at the beginning, look through multiple lenses and start to weave that together in a more holistic understanding. But as it is right now, especially in psychiatry and mental care in the healthcare paradigm in the West right now, we generally have symptom checklists that define diagnostic labels or disease states, and then symptom management. So if people fulfill criteria on a checklist, then there's management strategies that are employed, and predominantly those involve managing symptoms. And to a large degree, because of how sophisticated reductionism became over the last couple hundred years, we have biological pharmaceutical agents that then get assigned to different conditions, like SSRIs for depression or SNRIs for anxiety, mood stabilizers for bipolar conditions, naltrexone, for example, for alcohol use disorder. And while these treatments certainly may have their benefits, there's a limitation of the if A then B kind of understanding of who we are. And you know, as a medical doctor, and especially working in chronic pain, I come across so many patients who have been to many doctors and they don't feel seen as a whole person. They feel like they are seen as their diagnosis or symptoms, or they are seen as a problem that requires something outside them to be fixed. And there's this really you know, suffering, and especially mental illness, but all forms of suffering can be such isolating experiences. And yet we've got these one-on-one doctor interactions where people are sort of seen in isolation instead of seen as connected to the web of all the different social determinants of health, and how our the food and the air we breathe and everything else, our relationships and our histories, are actually bearing on how we're showing up and the symptoms we're presenting with in the moment. So this, I'm going to explain a little bit in sort of this this slide that has some animations, how we can think of like ourselves as complex systems, kind of like a tree, right? It's got roots into the earth and then the leaves at the top, and the roots at the bottom are really sort of our earliest influences. So the things that start to influence us in very early childhood. And at the top in this model, the biomedical model and the biological psychiatry model of understanding, the leaves are these diagnostic labels. So if we look at this, let's just think though about everything that comes before the leaves. Early on, we can have physical or emotional neglect, abuse, conditions of stress. Maybe our parents were stressed, maybe they lived in a wartime, whatever has happened when we're just entering this life and this world. And these can influence our attachment, which is very important for well-being, causing insecurity in our attachment to our adult caregivers. There are other stressors we can encounter, like poverty, racism and discrimination, bullying, and other traumas. And we can very early on experience felt states of confusion, sadness, rage, anguish, shame, terror, and hopelessness. And we can then disconnect from our experience and because it's too painful, dissociate. We can become very isolated. We can develop challenges with our attention. We can develop blame of ourselves or others, and really starting to just respond as best we can to these abnormal circumstances. And this forms, as Manesh was talking about, our expectations, our templates of what relationship actually is or can be, our beliefs and our biases of perception. And when we're unwell, these templates that we have, these expectations, beliefs, and biases tend to be somewhere either too chaotic or too rigid, somewhere there. And then add to this more stressors, and we can really show, if we haven't already, post-traumatic symptoms of trying to adapt. And this can then show up in different ways. And this isn't fully inclusive. All these words I've put on the screen, there are many words that could be added here, but things like addictions, control patterns and behaviors, suicidal parts, perfectionism, what have been labeled as personality disorders. And so really what we can end up with is this, like, I like to think of it as maybe like a tightly bound and knotted up ball of yarn, that starts really early and then just keeps getting wound over time with those early templates informing the next and the next. And when we try to treat things from the outside, so I'll just go back, just from the outside, like with a drug, for example, to address the leaves, the symptoms, it makes sense that we can really only get so far, and we're sort of like managing symptoms, but not really getting down to those roots. Instead, if we have the conditions that support like a loosening of that ball of tangled yarn, which is something that psychedelics can actually do. The relaxed beliefs under psychedelics model, relaxing all these heavily weighted priors and actually helping us to access maybe for the first time some of these deeper layers and get to see them and work with them, and then start to work from that place closer to the roots. Then we have this opportunity to start to reweave and rewire this whole structure. Now, it was mentioned in my bio at the start that I'm certified in functional medicine with the Institute for Functional Medicine, and this is the functional medicine matrix. So before I even became a therapist or involved in psychedelics, this was the new way of looking at humans, the people that I treat. That was a bit of a difference from what I learned in medical school. And so they have this matrix, and it's designed to be able to understand people from this lens of complexity. And I'm not going through the whole thing today, but wanted to highlight what's highlighted here in pink, that the core of the functional medicine matrix is our mental, emotional, and spiritual selves. And very important modifiable lifestyle factors are stress and relationships that we are encountering. So let's talk about what I like to call whole human health, and some of the influences, if we go from the bottom up again, from roots to leaves, that can look different when we do have these nurturing conditions, when we have play, attuned connection, a sense of physical and emotional safety. Very, very early on, when we're infants and small children, we have healthy touch inputs, co-regulation from our caregivers. Atira talked about co-regulation and its importance in this work, and opportunities for reciprocal attuned interactions with our caregivers, which actually builds our brain architecture and builds into us our resilience and really supports secure attachment, interoception, the ability to accurately feel our felt sense, to be embodied. And this informs our emotional intelligence and our ability to self-regulate in the world. We can develop traits of connectedness, creativity, focus, curiosity, confidence in ourselves, in our secure attachment, and the ability to empathize with others.